my name is Molly, and we will be assessing our patient Joe today. So I'm going to first start by introducing myself, doing hand hygiene, noting that Joe looks appropriately dressed and for the weather, and asking him what brought him in today.
Pain in my wrist.
Pain in your wrist. When did that start?
2 months ago.
2 months ago. Where exactly is it hurting?
It's kind of here, but then radiates outward. Kind of right at the wrist area, and then radiates.
Okay. So you said that's been going on for 2 months.
2 months.
Has it been getting worse?
A little bit. Yeah, I'd say so over the last 2 months.
So it's been gradually getting worse.
Mm-hmm.
Okay, not suddenly.
No.
Overnight. Okay.
No.
Okay. What does it feel like? Is it a dull, sharp, achy?
Achy. Just some things are sharp, but generally pretty achy.
Okay. What would you rate that on at a 0 to 10 scale?
6.
6. Okay. Does anything aggravate that pain?
Evening, like it gets worse in the afternoon, evening time frame, but nothing.
Does it get worse when you sleep?
Yeah.
Okay. But afternoon, evening, nighttime.
Yeah, it gets worse just after a day. I mean, just as the day goes.
Is it worse as when you use it a lot? Or,
Yeah.
Okay. What about, does anything help it, make it better?
I've taken some Tylenol to try to help it. It does a little bit.
Does resting help it?
Yeah, if I don't use it, yeah, it helps.
Have you tried ice or heat?
Yeah, I tried that early on, and the ice was good, but I mean, then I just started taking Tylenol because I didn't have a ton of time.
Okay. And for radiation, you mentioned that it radiates up your wrist a little bit, but it's mostly, where does it mostly hurt?
Just kind of right in the wrist area.
And then it radiates up the arm a little bit?
Yeah.
Okay. Let's talk about timing a little bit more. Anything you're doing differently lately?
Doing a lot more at work, a lot of writing and stuff, and just so I'm just using it a lot more lately.
Okay. Is it both of your wrists, or is it just the one?
No, just the one.
Just the one. Okay.
Yeah.
Let's see. Are you stiff or sore in any of your other joints?
Mm-hmm.
Okay, so it's just the wrist.
Mm-hmm.
Any nausea, vomiting, fevers, any chest pain, shortness of air?
No.
Okay. Any congestion, anything like that going on?
No.
Any changes in medications?
Mm-hmm.
Do you take any medications?
No.
No, not anything?
Nothing.
Okay. No over-the-counters, herbal medications?
I mean, short of the Tylenol now for those, but yeah, no, nothing.
Okay, how often were you taking that?
Twice a day.
Do you know the dose?
2 of the tablets.
2 of the tablets, twice a day, for how long?
For about a month now.
Okay. Any vitamins?
No.
Okay, so no prescription medication, nothing other than that Tylenol twice a day.
Yeah.
Any medical history for you? Any heart disease?
No, everyone's pretty good on the heart.
Lung for you. This is just for you. For lung history.
No, nothing on me.
Okay, so you've never told you were diagnosed with like RA, any osteoarthritis, any autoimmune problems? Okay, so now what about for your family? Any heart history?
Yeah. No, everybody's pretty good.
Cancers? Any autoimmune diseases?
Nope.
RA? Any lupus? Anything like that? Okay. What about drugs? Any illicit drug use?
No.
Okay. Immunizations? Have you gotten the flu shot?
Yeah, I got it about 2 weeks ago.
Okay, great. Let's see. Any surgical history?
No.
Any family history? We talked a little bit about that. No family history for anything?
No surgeries or anything, no.
Okay. What about, so no history for RA, OA, any autoimmune diseases in your family? Okay. Allergies, medication allergies, food allergies, seasonal allergies?
Yeah, sometimes in the fall I get a little cloudy, but nothing major.
Okay.
Sneeze a little bit more. That's about it.
What about do you smoke?
No.
Do you exercise?
Yeah.
Do you eat a healthy diet? Okay. What do you do for work?
I do a lot of just corporate reading and writing of our corporate plans, and I do a lot of communication marketing stuff. So
okay. Any recent like car accidents, trauma?
No, nothing recent.
Nothing that you can remember that might pinpoint that back to.
Mm-hmm.
Okay. Well, the nurse grabbed your vital signs. Looks like you're at 98.2 temperature, 112/74, blood pressure 68, pulse 16 respirators and 99 O2. So it looks like everything's stable there. I'm going to first start out by just inspecting his wrist here. I'm going to look at both of his hands kind of side by side. Start with inspecting his wrist, just kind of checking on the texture, making sure it all looks nice and smooth, no skin issues, and then we're going to kind of go into the joint here. Does it feel
yeah, it's a little
tender
sore
when it palpate it? What about on the other arm?
No, it's fine.
Okay, so we're going to look at the first start out with the palmar surface. Look at any swelling and see if there's any noticeable lacerations, any burns, bruising, anything that could be directly causing his pain. I don't see anything noted or noticeable right off the bat here. And we'll take a peek at his dorsal surfaces as well. They look good bilaterally. We're going to take a peek and see if he's got any of those Herberton nodes or other nodes that could be inflamed, pointing to osteoarthritis. I don't see any causes for concern there. If we can check a little bit of range of motion there. Is any of that tender?
Yeah, this side is.
It is, okay. Okay. And then we're also going to check for thickening of his flexor tendons. So I see a tiny bit here on this right side where he's complaining of the pain. And see also if there's any ulnar deviation. So I don't see any of that on either side. Again, we're going to go ahead and start palpate both the radial and the ulnar joint here. See if there's any bogginess, swelling, tenderness. Is that sore? Mm-hmm. Okay. What about on this other side here? Mm-hmm. Okay. We're going to also look at each of the metacarpals and check out the 8 carpal bones here just by palpating through his hands here. And then any tenderness there?
A little bit, yeah.
Where exactly? Through the joints?
Just
or
through the joints.
On your fingers?
Mm-hmm.
Is it worse on any finger in particular?
No, not in all about the same.
Is it worse kind of on these outer fingers, perhaps?
Maybe a little, yeah.
Whatever. On the other hand here.
No, this one's fine.
Okay. Let's see. We're going to look for, check the radial styloid bone as well here. Kind of palpate that here on both sides. We're also going to check each thumb here for, look for any enlargement, any tenderness, any bogginess that could alert us to something going on here. And he does have quite a bit of swelling, bogginess, and is a tender through here, kind of through that radial part of his hand there, through that wrist. Any tenderness over here? Okay. That kind of helps us to rule out any RA. Let's see. Or keep it in as a possible differential diagnosis. We're going to check for range of motion. So we're going to start with flexion. So put your palms down. Point your fingers and then go ahead and kind of point your fingers to the floor there. And then now we're going to extend. So how's that? How does that feel?
Yeah, this one hurts.
Does it? Okay. We're going to try to adduct here. So we're going to keep your palms down and let's see. Bring those fingers midline here, and then we're going to adduct. There you go.
This one, doing that causes a little bit of sharp pain.
Okay. Let's see. So go ahead and grab and do the hand grip test here. So as hard as you can on both sides.
Yeah.
Does it hurt there with that right hand still? Okay.
Yeah.
And we're also going to do the Finkelstein test. So you're going to go ahead and put your thumbs down like this, and then put your fingers over, and then try to point those thumbs to the floor. Is that sore?
Mm-hmm. Yeah, this one's fine. This one's really sore.
That's sore as well?
Yeah.
Okay. Let's do your thumb abduction. So you're gonna, let's see, raise your thumb straight up. Let's see. There you go. So raise it up there, and on the other side. So thumb adduction and abduction. Very good. And then the Tyndall sign here. We're going to tap over that medial nerve. Is that icky?
Mm-hmm.
Is it kind of numb, tingly at all?
Tingly.
What over here?
This one's just normal.
Is it numb or tingly over there?
Mm-hmm.
Okay. And then the Fowler sign here. Can you go like that? Is that sore?
A little, yeah.
Is it numb, tingly?
A little numb on this side.
Okay, very good. Push that together. Okay, very good. We're also going to do some opposition as well. So go ahead and kind of go back and forth like that. Sore?
Yeah.
On that side
this
still?
side's fine, yeah.
Okay, I'm going to check your pulses here.
Sure.
See if there's anything peripheral vascular going on. So his radial pulses are both 2+ bilaterally. And then I'll check your pedal just to see here.
Okay.
Let's see if you can see. Also 2+ bilaterally. We'll go ahead and check your reflexes here. So we'll do your triceps. There we go. So relax that. There we go. And then your biceps. And your let's see, brachioradialis. There we go. I'll do that on both sides here. And brachial. There we go. So we'll do that. And then I'll check your knee real quick. Just kind of get all those reflexes. There we go. And then your plantar here. There we go. Let's see. So I'm also going to do a quick heart and lung assessment on you real quick, as we do for everybody. So we'll listen. Yeah, take a deep breath. Look for any Here you go. Lungs are nice and clear and all this low. Check the front here. Nice 2-to-1 ratio on both sides, symmetrical. Very good. And we'll listen to his heart as well. Listen for any murmurs, revs. Listen for a nice S1, S2 sound on all of his areas of auscultation here. Very good. So as far as a differential diagnosis, we came up with carpal tunnel, let's see, de Quervain's tendonitis, and acute RA. I'm going to go ahead and say that I think he has carpal tunnel syndrome because he's got the pain, numbness, weakness. He, in his history, subjectively told me that he's got some nighttime pain, and he does objectively here has some swelling and swelling, redness on his wrist, and also he was complaining of some numbness. Several of those tests we did confirmed that he's got probably some tendonitis going on with that numbness and tingling. The de Quervain's tendonitis, typically you've got pain from overuse, which is what he was complaining about subjectively here, but he would have had more pain with the gripping maneuvers, and also some limited range of motion. The Finkelstein sign, he said it was positive, but I think he's got more of the carpal tunnel syndrome going on. And then the acute RA, he would have had pain on both sides of his wrist instead of just one side, so he would have had it bilaterally. Was probably the biggest sign for the acute RA, and he would have had some increased swelling throughout his fingers as well. So those are our differential diagnosis, and I think we'll get you treated for carpal tunnel.
Sounds good.
Thank you for coming in.